I can give you the rundown on the current numbers. I think what's important there is the trend lines we described yesterday are continuing. Hospitalizations up, but not spiking up. The infection rate is down a little bit. 32 new hospitalizations, so you see the beginning of a bit of the surge there, but we still are managing that pretty well. I really wanted to come in this evening to talk about something else because the president had a passing comment on his way to the helicopter. Then he retweeted that he was considering a, quote, mandatory quarantine for New York City, New Jersey, and parts of Connecticut. And words matter. And those words have created a certain amount of confusion. And when you lack clarity, that can create confusion, and confusion can lead to panic. So let me tell you what I know and what I don't know. And I've been in close contact with New York, New Jersey, Rhode Island, so we try and read those tea leaves. I've had a brief conversation at the White House. And basically, I think they were thinking out loud about relooking at the hot spots, including New York area, including even Louisiana and Detroit, and figuring out what to do. And they said, we're thinking about a wide array, everything from lockdown to the status quo. And I tried to point out that, remember, the status quo from Connecticut and my fellow governors in Rhode Island, New Jersey, and New York is one, stay at home. And that is a mandate that is increasingly being followed. It is two, if you cross state borders, get yourself, if you're not tested, get yourself quarantined for at least 14 days. Something our other states are doing, something Gina's doing up in Rhode Island. I said, look, we're discouraging people from traveling and making sure they stay at home as much as possible. And I explained to the White House that these words have effect. And Metro North ridership is down by 95%. So if you're thinking about cutting off commerce, think about how much we've already accomplished there. I said, look, if you want us to, make the 14-day quarantine for people crossing the state even stricter, let's talk about that together. But all of the governors, meaning Murphy, Cuomo, and myself, New York, New Jersey, and Connecticut, really worried about even the prospect of what a lockdown would look like. Look, we're not Rhode Island. New York City and with New Jersey and southern Connecticut is the global capital of the world for commerce and for finance. And if you care as much as the president does about getting this economy going again, you've got to be very careful about what you say and what you don't say. I'm struck by the fact that the population of Manhattan doubles every day during work days. Give you an idea, not to mention hundreds of thousands of people going to Connecticut and New Jersey leaving Manhattan. So you have to be very careful about what you mean when you say a mandatory quarantine. We had our brief conversation, and I reminded what happened in Wuhan province. And in Wuhan, just the mention of that quarantine did lead to a mass exodus of people there. But I'm not saying there's not more that can be done, and I'm saying we're going to work collaboratively with the White House to get more done. And I'm certainly going to work very closely with my fellow governors, because I think when we work together as a region, we work a lot better together. So I don't want to sit around, and I'm happy to take your questions, but I can't speculate on exactly what the president meant by a mandatory quarantine. But I can tell you that we're working together on this. We're the ones that have to enforce it, we the governors. There are, hundreds and hundreds of roads leading in and out of the New York metro region. It's something absolutely unenforceable if they are talking about slowing down or stopping traffic. So we're going to work with them collaboratively. I hope we'll have clarity from the White House before this night is over, so that before the day comes, people know exactly what they can expect. and how the White House and the governors and the mayors are all working together to keep you safe. You know, with that, I'm trying to answer a few of your questions, but I am going to be very careful not to speculate further.
Brian Ditlake with Fox 61. In regards to mentioning Rhode Island, we've seen cases where the National Guard has went door to door, knocking on people's homes, trying to see if there are New York plates in their state. Will we see that happen here at all?
No, I don't anticipate that. I talked to Gina Raimondo, the governor there today. Look, there's one main highway that goes in there. They have some guardsmen there or state troopers. If you have New York plates, they do ask you to go over, and it's a friendly reminder. They tell you, self-quarantine for 14 days if you're coming into Rhode Island. We do that in a less formal way right now, but I order people clearly, we want you to self-quarantine if you're coming into the state of Connecticut. She had something interesting I'm thinking about, which is where if you're renting a place in Rhode Island for a short-term rental, they put in there if you're from out of state, a rider that you should self-quarantine as well. So we're going to be following a lot of the same social distancing rules and keeping an eye on out-of-staters coming in and out of the state, just like Florida and New York are thinking about out-of-staters coming in and out of their state.
Who did you speak with at the White House?
We had a high-level conversation at the White House.
It wasn't the president himself?
It was not the president himself.
And did they tell you that they're going to, be taking further action to mandatory quarantine?
They told me that they valued the input from the governors and that they were now going to make a decision in terms of what they meant by a mandatory quarantine, and I urge them to do that now before thinking out loud again.
They didn't offer any timeline for you?
I hope this evening.
This evening?
Do you think the president has the legal authority to do it?
I know that the White House is looking into whether or not they have the legal authority. Look, these are extraordinary times to take extraordinary measures, but we're also a nation of laws. And by the way, it's Governor Cuomo and myself and Governor Murphy. We're the ones that have to enforce these laws. So you got to work with us in a collaborative way. And they reached out today, so that was the start.
Governor Cuomo said earlier that doing that would be tantamount to a declaration of war on states. Do you agree with that?
What did he say?
He said that it would be a declaration of war on states if he makes that decision.
I phrase things a little differently. That is, look, they can propose, but we got to dispose. We're the ones that would have to enforce these rules, and let's work together to make sure that it's rules that work, don't upset the economy, and don't upset the populace, and yet give them confidence that we're working together to do everything we can to stem the tide of this pandemic.
We can't speculate, but what would enforcement look like here in the state? Because you just mentioned that we have plenty of roads going in and out of New York at this point in time. So what would enforcement even look like? Will we have the National Guard or just local police enforcing this?
Let's see what they mean by mandatory quarantine. But obviously, if it's doing something on the roads, that's impossible to enforce, given the spider web of roads and traffic and coming in from all different directions.
The state tried to fight it, including in the courts?
I don't think we're going to have to be there. I think we're going to work through this.
Governor, how many people died today? Do you have an update on the number of deaths we've had?
I think we have a total of 33, so I think that was 6 additional.
And
5 from Fairfield County.
Are you considering, you've had, I think I've lost count now, 12 executive orders or 13 executive orders mandating certain things. Are you going to be taking any further action that you can take as governor to limit crowds, limit possibly services?
I think we are going to do more executive orders. I think my first step, Christine, is keep talking to the White House, see what they are proposing we think about on a regional basis, and then make sure whatever I do in collaboration with my fellow governors and make sure it's actually enforceable and doesn't make the situation worse. You know, panic can make the situation worse. Lack of clarity can make the situation worse.
Governor Cuomo also said he thinks the policy of checking on New Yorkers in Rhode Island is unconstitutional. Do you agree with that?
Seems a little aggressive to me. Yeah.
Governor Chris Powell, Journal Inquirer.
Hey, Chris.
Chloroquine has been discussed as a possible therapy for the coronavirus. A few days ago, it was reported that Governor Cuomo had asked the president to have tens of thousands of chloroquine tablets sent to New York, and the president was said to have agreed. Yesterday, in a front-page story in the Connecticut Hearst papers, there was a feature about the Wilton guy who got sick at a conference in San Francisco, came back, was deathly ill, was put into an induced coma, but has recovered and is now at home. In the body of the story, deep down, I think they buried the lead, the Hearst papers reported that he was cured by a combination of chloroquine and an antiviral drug called Calatar. There have been reports in Britain and other places that chloroquine in combination with an antibiotic Zithromax and zinc has had very good effects. There was Chinese research about this on the internet 3 or 4 weeks ago. The question is first, do you know if Connecticut has any stocks of chloroquine, if it's being used in any therapies? Second, do the hospitals report to your office about what therapies are being used and what are successful and what are not? I guess that's really about it.
Thank you, Chris. I'm not going to try and pronounce the names of these drugs, but what I can tell you is there's been some reporting, some short-term tests coming from France, coming from the example you brought about, that suggests they may have some impact on mitigating the effects from the coronavirus. I do know that we've talked to hospitals around the state, and they do have a supply of these. We worry a little bit about the potential for hoarding of drugs and therapies like this, because they're also there for malaria and a variety of lupus and other things that are very important. But what I don't want to do is tie the hands of our doctors either. I want to make sure they have the freedom to prescribe this where they think it could be effective. We know it's been out there in the marketplace for years now from a safety point of view. Now we're testing the effectiveness.
One more thing, Governor. The British press has reported that the British government has recruited more than 500,000 volunteers, mostly lay people, but also the retired medical people you've appealed to form a volunteer corps for the National Health Service over there. Is there any contemplation of trying to form a volunteer corps for our hospitals here in Connecticut?
I think that's a great idea. We are trying to do that right now. I've got a PSA out there. We've had 1,000 nurses who have come back from retirement. We're trying to get folks in our nursing schools, get them accelerated faster. We're trying to get medical assistants, for example. Maybe they were in dental, maybe they're in some elective surgery facility. Get them retrained so they can help out as we build our stock of people. And more broadly, we'll think about other volunteers who could be helpful as we prepare for the surge.
Did you remind the White House when you spoke to them that they're obviously seeing this as a hot spot where there are a bunch of cases, that you have not received any ventilators from the national stockpile?
I did bring that up, as a matter of fact, Christine. I said the only thing I like about the president's comment, the only thing, is that he's thinking about this is a zone, and that includes not a state border. That's New York City, that's parts of New Jersey, and that's parts of Fairfield County. And I did say I want you to think about this zone not just in terms of enforcement actions, but in terms of supply as well. Because I think that Andrew Cuomo is never going to be able to put out the fire in New York unless we can put out the fire in Fairfield County, and that includes ventilators, that includes PPE, and all the other material we need. We've got to be in the front of the line right alongside our other neighbors who are part of this hot zone.
Has there been any progress on that since yesterday?
Not much.
Okay.
Little bit. I mean, the volunteers are coming forward. We're doing everything we can internally, and we are getting hundreds and hundreds of pieces, but not on the scale that we need.
We've heard a lot of people saying that they think that many people are not staying home. Too many businesses are open. Do you agree? Do you think there needs to be tougher restrictions right now?
Well, let's talk to my neighbors and let's talk to the White House on that. If they think we have too broad a definition of essential services, maybe we should do something together. But I'll tell you, like I said, the rails are empty. The roads are increasingly empty, and I think people are prioritizing essential services and stay home where they ever can.
Speaking of essential services, Governor, we were there as the National Guard received supplies in Shelton yesterday. Do you have an update on National Guard operations in the state?
On the Guard operations in the state, you said?
Correct.
I can tell you they've been valuable for us, helping us get the field hospitals going, helping us, get transport materials between different hospitals right now. I know that in some other states they're there helping with heat sensors and patrolling ingress and to some of our major facilities. They've been invaluable. I want to be treated like the other states, though, when it comes to having the feds pay for our Guard services. Again, right now I think it's California, Washington State, and New York State. We are part of that hot zone. We should be treated the same way.
Governor of the South Langston News 8, piggybacking on these comments, we too have been getting reports from our viewers about a number of incidents where a large number of people are gathering, ignoring the social distancing guidelines. What is your message to those people who are doing this?
You're endangering yourself, you're endangering your neighbors, and you're endangering your family. Take this absolutely seriously. I've asked our police to go in and break up those groups and tell them on a friendly basis, you've got to separate. We've got volunteers going to our park system this weekend, as long as it stays dry. Again, going to those groups of young people often that aren't taking this as seriously as they can, and separating them and say maintain the social distance. It's in your best interest, but it's in the community's absolute best interest.
Do you see a tougher stance coming down the road if this continues?
Yep.
What would that look like?
To be determined.
In your conversation with the White House, did they give you any indication about a response to the request for the major disaster declaration that you sent a couple days ago?
No, I can tell you we're moving on that pretty hard, and our congressional team, led by Senators Murphy and Blumenthal, are pushing that. I think we'll have some good news on that. I can't tell you when. Thank you, everybody.